Dr. Kate here. I get a lot of questions from patients regarding the chiropractic adjustment. They want to know, what is a chiropractic adjustment? What's happening in my body and what structures are affected? All of these are valid questions. Let me explain. First things first, let's discuss where the chiropractic adjustment is occurring, and that is the facet joint. I'll show you on this model. Here we have a model of the spine. Okay. You can see on the back here, we're looking posteriorly from back to front. Right here are the facet joints on either side. This is what allows movement of the spine. You can see them move this direction. Okay. Surrounding the facet joint is a joint capsule, as well as some ligaments to maintain the integrity of the joint, which you can't see in this model. There are also nerves feeding forward and back, communicating with the body about the joint. The problem occurs when this joint stops moving or becomes fixed. There are lots of names for this phenomenon. Some people call it segmental dysfunction, some people call it subluxation, some people call it a functional articular lesion, but the main take-home is the same: the joint has stopped moving. When the joint stops moving, it can cause a lot of issues throughout the body, so our focus with a chiropractic adjustment is to get this joint back to optimal movement. Now you might ask, Dr. Kate, what's so bad about a joint not moving? Well, lots of things. First of all, it can cause pain and dysfunction of the surrounding musculature, which are involved in the joint. These muscles can sometimes spasm or compensate, leading to other problems throughout the body. There is also problems with the soft tissue, like cartilage in the joint. Cartilage needs to move in order to be fed, and so if a joint isn't moving and the cartilage isn't moving the way that it's supposed to secondarily to the joint, then you're going to see degeneration of the joint and early arthritic changes. This is what we hope to prevent with the chiropractic adjustment. Another big portion of the chiropractic adjustment is the neurological effects. Here, let me show you the relationship of the nerves to the joint. Here's my model again. You can see the facet joint right here that we were talking about. Right next to it is a little opening in the spinal column called the intervertebral foramen, or the IVF. This is where the nerve root comes out. Can you see this nerve root here? This nerve is coming off of the spinal cord and sends information from the brain, ultimately, down the spinal cord and throughout the body, and vice versa, from the body back up to the brain. You can see from its proximity, this nerve root's proximity to the facet joint, that those two are very intimately connected. This is how, with a chiropractic adjustment, we can change function of the nerve as well. And that allows us to change function of end organ systems, like digestion or the immune system. This is a very important and really handy side benefit of getting those adjustments. The take-home message is this: chiropractic adjustments restore optimal movement and function to the joints. This results in a cascade of health benefits for the rest of the body. Thanks for watching, and stay tuned for more informative videos like this one from your friends at DBC Natural Holistic Health Center. Cheers!